Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Dr. Eric Osansky with us. Dr. Osansky is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has been helping people with thyroid and autoimmune thyroid conditions since 2009. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves Disease, the Hyperthyroid Healing Diet, and Hashimoto's Triggers. He is the host of the Save My Thyroid podcast and the creator of the Gut Healthy Thyroid newsletter. Dr. Osansky was personally diagnosed with Graves' disease, and after seeing how well a natural treatment approach helped with his condition, he began helping others with thyroid and autoimmune thyroid conditions. Welcome, Dr. Osansky. So glad to have you.
Yeah, thanks, Dr. Lauren. Appreciate you having me. Excited to have this conversation with you.
Absolutely. So, the Graves is a little bit less common, at least in my experience, than Hashimoto's. So, I don't know the statistics though. Do you have any idea what that is? And can you tell us a little bit about the difference between them?
Yeah, I think Hashimoto's is like 8% of the population compared to like 1% with
Right.
Graves. So definitely a lot more common
Yeah.
with Hashimoto's.
Mm,
And But I mean, I do see a lot of people with Graves just because of my personal journey with
specialty, sure. No, that makes,
yeah.
yeah. And how often do you see people who have antibodies to both, like both sets of antibodies?
Yeah, great question. I'd say probably like 20 to 30% of people have both, very common.
Right. Yeah, absolutely. So tell us your story. Like, what was your journey like when you got diagnosed, and did you go the conventional route? I mean, possibly not with your background, but I mean, did you go the conventional route for a while? What did you end up kind of discovering along the way?
Yeah, so I was diagnosed with hyperthyroidism in 2008 and just was walking around a retail store and I didn't have really any indications well, I was losing weight, but I was trying to lose weight. Little did I know that some of the weight loss was related to that.
Right.
But I took my blood pressure at one of those automated blood pressure machines. My resting heart rate was 90. My blood pressure was fine. My heart rate was high. Took it the next few days, was anywhere between 90 and 110 beats per minute. So I
Yeah.
went to just a regular doctor, got some blood testing done, got diagnosed with hyperthyroidism. Didn't take anything. Figured well, I'll jump to the story. I went to see an endocrinologist, and endocrinologist officially diagnosed me with Graves and recommended anti-thyroid medication. And I decided not to take the anti-thyroid medication, and the reason is because as a chiropractor, I would always take nutritional and functional medicine seminars as part of my CE credits, and I took a few functional endocrinology seminars, and of course, they didn't focus much on Graves, but they did bring up some natural remedies, so bugleweed and motherwort, some herbs that can help with the symptom management
Yeah.
of hyperthyroidism. So yeah, so when I was diagnosed with Graves, I figured let's give it a try. I had no idea if it would work. I never knew anybody who tried those herbs, but I
Yeah.
figured I'd give it a try. And if it didn't help, I was open to take the medication.
Right.
But thankfully, they did help, and so I was able to avoid the conventional treatments. I mean, some of my patients, of course, do need to take the antithyroid meds, but through diet, lifestyle, doing some testing, some supplementation, I was able to restore my health. And since 2009, I started helping others with Graves and as well as those with Hashimoto's.
And what do you find, maybe in your story or maybe in the patients that you see, are some of the reasons why onset occurs in the first place? Is there a pattern?
Stress is a big one, and I know stress gets blamed on a lot
For
of
all the
things,
things. Yeah.
but it is true. And in my situation, it wasn't just emotional stress, but one thing I didn't mention is I was overtraining. I was over exercising. So
Okay.
I mentioned I was trying to lose weight and I
Right.
was also I was dieting. I was on a restrictive diet, but then I was not listening to my body essentially. And so I
Yeah.
think it was the combination of the emotional stressors and the physical stressors.
Mhm.
So that's one thing. That's very common as far as the stress. Almost everybody on the health history form will
Mhm.
put stress as being a factor at one
Right.
point of at another.
Yeah.
So stress, food could be a factor.
Mhm.
Gluten, most functional medicine practitioners tell their patients to avoid gluten for good reason because that potentially could be a trigger, not just in celiac disease, but a factor in other autoimmune conditions. And then certain infections. I mean, during the pandemic, we had a lot of people come in with Graves compared to normal. So certain viruses and other
Mhm.
types of infections can also serve as triggers.
Yeah. Are there specific, so I think you're referring to molecular mimicry, right? Okay. So are there specific viruses that you see more often than others, or specific organisms in general that seem to be a culprit for that if molecular mimicry is playing a role in Graves?
Well, I mean, almost everybody has Epstein-Barr, so sometimes it's hard
Yeah,
to make that connection. Is
sure.
it a factor? And
Yeah,
honestly, if I like, I do sometimes treat. I mean, I'm sorry, sometimes test for viruses, but
right.
I look at it also more of an immune system problem than a virus problem because we're not
Right.
going to get rid of Epstein-Barr. So
Mm,
again, in the literature, it does show like there are studies showing at least a correlation between
mm,
Epstein-Barr and Graves and Hashimoto's. Now, again, correlation doesn't always mean causation. And like I said, I used to like put people on antiviral protocols. And I'm not saying I never do that, but
mm.
now my approach is let's
Often,
optimize your immune system.
sure.
So to answer your question, I mean, yeah, I mean, Epstein-Barr
Yeah,
potentially, COVID. I mean, that definitely seems something was going on then. And it is
right.
also in the literature for not only Graves, but subacute thyroiditis, which is a different type of hyperthyroidism.
Yeah.
Um, Not necessarily molecular mimicry, but H. pylori. There's a number of different studies and showing that relationship, and it is something I see on a lot of people positive H. pylori findings. And again, it's not always necessarily the trigger. Maybe it's
Be part of
a
the
factor,
milieu.
and at least in some people, yeah.
Yeah.
So
So, and if you're not specifically focusing on going after specific organisms, when you talk about immune optimization, what does that look like for most people?
Well, I mean, it all starts with the foundations. Obviously trying to eat whole, healthy foods, avoid refined foods
Yeah,
and sugars. We mentioned stress already, just
right.
trying to not eliminate stress because I mean, it would be
Can't
great if we
do that,
could, but
right?
at least minimize stress
Yeah.
and probably more importantly, just improve our stress handling skills, getting
Mhm.
sufficient sleep. I mean, a big thing, which I'm sure many others have spoken about on your podcast, are toxic environments. I think that's a big factor in dragging down our immune system, making us more susceptible to infections, and just overall, I mean, disrupting our gut. I
Mhm.
mean, things like not only heavy metals, but the microplastics now that everybody's talking about. I
Sure.
mean, and plus in addition to that, they're also not only affect the immune system, not only affect the gut, and most of the immune system cells are located in the gut,
Mhm.
but as you know, also they're endocrine disruptors, so they also can directly affect the thyroid
Mhm.
and probably more likely cause hypothyroidism than hyperthyroidism. But
Yeah.
nevertheless, I mean,
There's
so that's big, just trying to minimize exposure to environmental toxins and toxicants.
right. And are there any specific, so I know that like, big basket of toxins can cause all kinds of different problems. Are there any that are more often correlated with Graves in particular that you've found, or is it just kind of like the toxic soup that we all live in general?
Yeah, I mean, I do see a decent amount of mercury. I mean, aluminum, I actually find aluminum now, again, does that mean that the challenges I see pretty much exclusively Graves and some Hashimoto's patients, so I can't compare. I mean, we might get similar findings from a toxin standpoint
Sure.
with multiple sclerosis patients or rheumatoid
Sure.
arthritis patients.
Right. Yeah.
But those are common, like the metals.
Mhm.
Um,
A lot.
but also I don't do a lot of toxin testing too, just because there's so many different toxins out there. I
Sure.
mean, sometimes I'll do mold and mycotoxin testing, and
Yeah.
um, but I take the approach that most people are toxic. I think it's safe to say in this
Sure.
world we live in.
Yeah,
So.
definitely true. So, and what particular role, like maybe from a dietary standpoint, does iodine play in both Hashimoto's and in Graves? I know that there's some debate about where the optimal levels are and what that has to do with, other halides that could be potentially toxic. What's your position on that?
Yeah, great question. Definitely controversial in the world of thyroid health
Yeah,
because there are different perspectives. Some will say high dose iodine is the way to go. Others will say it's the opposite. You want to
right.
completely avoid it.
Sure.
I'm somewhere in the middle. I mean, I have experience with both. I mean, in the past, I definitely was more on the like supplement separately with iodine bandwagon
Mhm.
and I mean, first of all, iodine's important. I mean, if iodine's important for thyroid hormone formation, it also has other many other health benefits, important for breast health. So, but too little iodine is not a good thing. But I've also seen some problems with too much iodine, and as far as how much is too much, that also depends on the person. Like in the past, I was able to take higher amounts of iodine, and it didn't seem like it had a negative effect on me.
Mhm.
And then over the years, I realized that's not the case with everybody. And in fact, some people it could be a potential trigger. Some people it could really be a problem. And so now I'm not anti-iodine, but I'm more conservative when it comes to iodine. I'm not too extreme. Like some will say you want to completely avoid all iodine, and those with
Right.
Graves and Hashimoto's, like
Sure.
no iodine-based foods, which is not, so that means like no eggs, no. I mean, I usually recommend people to avoid dairy anyway, while at least while healing, but no seafood and no multivitamins with iodine. So I can't say I go to that extreme as far as like try to cut out completely iodine because again, I do think it's important, but but yeah, like it's I think the milligram dosing could people could run into problems with that.
Mhm.
So
Yeah.
I usually don't recommend like separate iodine supplements or even like really high iodine foods like kelp. Again, I'm cautious about. There are people that do perfectly fine taking
Right.
those, but I've just seen enough people where I don't know, like, and I'd rather play it safe and
Mhm.
not have them like supplements with like 12.5 milligrams or 50 milligrams of iodine and
Agreed.
eat kelp all day.
No, absolutely. I always call that a Goldilocks nutrient. You don't want it to be too
Yeah.
much, too little. It needs to be sort of in the sweet spot and in conjunction with all the other nutrients that are necessary for balancing too. But in the case of like acute Graves, where do you fall as far as like adding in goitrogens to sort of block iodine absorption? Is there a place for that, or do you kind of shy away from that idea?
I don't shy away from it. I've actually tried it. I just don't find that it's effective.
Okay.
Years ago, um, years ago, what pregnant women, because a lot of pregnant women who have that natural mindset, understandably, don't want to take medication. And
Sure.
so I was trying to figure a way, how could we manage the symptoms? Because herbs like bugleweed, there's really no research, and so it's
Sure.
not
Right.
indicated during pregnancy. So I actually had women eat large amounts of raw cruciferous vegetables, trying to block
Mm.
thyroid hormone
Yeah.
production, and
That-
really didn't notice a difference. So I think that in theory that would be
Yeah.
awesome, and
Yeah.
to just eat a lot of broccoli or
Right.
kale, but I
Sure.
just haven't found that to be effective. And then on the other side, for those who have Hashimoto's, because of that experience, I usually say don't worry about it. I mean,
Yeah.
listen to your body. If you eat raw
Mhm.
broccoli and you have some thyroid swelling, then maybe cook it.
Mhm.
But otherwise, yeah, I just haven't found that to
Got too
be the
much.
case.
Yeah, right. And I usually am similar. So typically when people have Hashimoto's, I won't really worry about the goitrogens unless their iodine is super low, in which
Yeah.
case then I'll say, okay, well, maybe until we can get the levels up. But other than that, probably don't worry about it a ton. So, what is your perspective? So you said that sometimes people have to go with a conventional treatment. Any particular like what are the major risks that you're looking for that you'd want to make sure that you mitigate if somebody goes on like methimazole or something along those lines?
Well, I mean obviously symptom wise they could experience symptoms, but the two main things that we look at and endocrinologists will also usually look at liver enzymes to see how much stress the methimazole or PTU is putting on the liver. And then sometimes it'll depress the white blood cell count.
Okay.
So those are the two main things from testing, like for what we would see on the test. But then other people will just like experience rashes and digestive symptoms. I mean, there's research out there also that it affects the gut microbiome, as do many
Sure.
other medicines. So
Yeah.
it's one of those risk versus benefit things. But
Yeah.
But if someone's tolerating it well, the thing is, not everybody could be on the bugle wheat doesn't work for everyone. So if
Right.
someone's on the methimazole and they're not having side effects, their enzymes look good, WBC count looks good, I'm
Mhm.
not going to advise them to stop the methimazole.
Right.
Just, I mean, first of all,
Sure.
I don't have
Sure.
prescribing rights, but then
Yeah. Yeah.
besides that, we just don't know if the bugle wheat would be effective, even if I was able to tell them to stop taking it.
Yeah. And I don't know if you have any experience with low dose naltrexone of this. Any particular thought on how that might play in particular?
Yeah, no, I do have some experience with LDN, and when it works, it can work really well in modulating the immune system. And it's just like anti-thyroid meds, it's not addressing a cause, but unlike anti-thyroid meds, side effects aren't as common. I mean, some people have sleep issues and
Yeah.
maybe some headaches sometimes, but it's not as extreme as
Mhm.
taking thimerosal.
Right.
Um, the downside is where the methimazole almost always works. Again, the LDN I find hit or miss. There's
Right.
some people that
Right.
take it and it works. Other
Mhm.
people take it, it doesn't work, and it could take time to know whether it works or not. Whereas like the
Sure.
methimazole typically will
Right
work
away.
relatively quickly.
Sure. Yeah, absolutely. And to what degree does your overall approach also include gut health, gut healing?
Well, I mean, with everybody, it's important, and it doesn't mean that with everybody I don't necessarily do a comprehensive stool test on everybody. I don't treat everybody for gut infections. Like I know some people treat everybody for parasites, and
Sure.
I'm not saying anything bad about that. That's just not my approach. But
Yeah.
diet, what we spoke about, the foundations are
Yeah.
important for optimal gut health.
Sure.
And there's that three-legged stool of autoimmunity, the triad of autoimmunity that suggests that everybody with an autoimmune condition has a leaky gut.
Mhm.
Um, and so, I mean, f food plays a big factor. Again, the stress that we spoke about that could decrease secretory IgA, which lines the mucosal surfaces of the body, including
Mhm.
the GI tract. I mean, so just incorporating the foundations at a bare minimum. Now, some people I do recommend comprehensive stool testing, or if they're having a lot of gas, bloating, maybe we'll do SIBO testing if they're, if like food's not really having much of an impact, or if food is having an impact, but it's the higher FODMAP foods, and
Mhm.
we figure maybe it's a SIBO problem.
Sure. Yeah.
So I think gut health is important with everybody, but like I said, I haven't found that everybody needs
Right.
to dive deep into the functional medicine testing.
Sure.
Sometimes just changing one's diet and lifestyle
Right.
will be sufficient.
Yeah. And you said like you mentioned bugle wheat a couple of times. Do you have any other like favorite go-to like supplement approaches for people, especially with Graves, but with Hashimoto's as well, maybe?
Selenium. So yeah, selenium is great, and with both Graves, Hashimoto's. Also should mention a lot of people with Graves have thyroid eye disease, which is also an immune system condition, and selenium also could help
Right.
with thyroid eye disease. Vitamin D, which I know is more of a prohormone than a vitamin, but still it's something that helps to modulate the immune system. And most doctors, of course, just look at the lab range and not the optimal range that us practitioners pay attention to. So having healthy vitamin D levels is important. And I find that, I mean, some people are able to do that through sunshine alone, but a lot of people do need to supplement, in my experience. And then omegas. I mean, if someone's not eating fish on a regular basis, and again, there's controversy with that too because of the toxins in fish. Should we be eating fish daily or even 3 times a week, or should
Mhm.
we not be eating it? But if you're not eating it, you're probably going to be deficient if you're not
Right.
taking a fish oil.
Right.
So I find that most people do need the omegas, and again, people could test for these as well. I mean, they could do a 25 OH vitamin D. They could actually do an omega-3 index. And again, if they're not eating fish or even having it once a week, they probably have a omega-3 index below
Sure.
8%, which is low. But those are three. I mean, there are others like alpha lipoic acid,
Mhm.
NAC, N-acetylcysteine. So those are antioxidants that also could be beneficial. I can't say I give them. I mean,
Sure.
NAC I do give a lot to a lot of people, but
Yeah.
some of these obviously do depend on the person.
Sure. No, absolutely. And you mentioned stress. So obviously, stress is associated with darn near everything. But I have seen that there does seem to be a pattern to Graves in particular, where it seems like there's a lot of stress as the kind of weak link. Is that, do you notice that that's more for that than maybe for other conditions, or not necessarily?
No, I do. I mean, you're absolutely right when it comes. I mean, not to say, and you're not saying this either, that people with Hashimoto's, it's not a factor, but I would agree. It does seem to be more of a factor compared to my Hashimoto's patients. It seems like I won't say 100% of my Graves patients, but I'd say like a good probably 90%. It
Yeah.
seems to be a factor. And I mean, you gotta it could be careful with the health history because sometimes they'll put lower stress on the health history, but then maybe like 6 months ago, stress was high. And so they'll like stress is maybe they've learned to do a better job of
Mhm.
managing the stress. But if you dig deep enough, and most people, you don't even have to dig deep enough. Usually it's pretty clear with the health history that stress is a big factor. So I would agree.
Right. Yeah. And I've certainly seen some patients where they'll tell me that they don't have a lot of stress, but then they recognize that when objectively stressful things happen, they get symptoms, whether it's, for this or whatnot. And I think in certain cases, if, you internalize and your body manifests the stress, those people are even more susceptible to symptom formation because they're not consciously aware of it. So certainly, yeah.
Well, that was, I mean, honestly, I was in denial when I dealt with
For you.
Graves. I didn't think, I mean, I knew stress was a factor, but I thought I just naturally did a good job of
Little bit.
handling the stress.
Sure.
So I did an adrenal saliva test, and you can
Mhm.
make the argument that, well, most people have messed up adrenals, imbalanced adrenals, so we probably don't need to do the testing, but I needed that test, I felt, to see that my adrenals were not where they need to be. And I find a lot of people benefit from seeing, okay, my cortisol levels are either too high or too low, my DHEA is low, and then they realize, hey, I do need to work on it. And then it's something they could, if they want to, they could always test later. Some people
Right.
maybe they don't test and they just realize, okay, I just need to block out time for stress management on a daily basis.
Yeah, absolutely. So, what have I not asked you that you would like to make sure you leave with our audience?
You did pretty good. I mean, you hit the symptom management is important when it comes to Graves and hyperthyroidism as well. Iodine, a lot of people don't touch upon the iodine. So, but you did that and the goitrogens as well, which not everybody covers that. We spoke about not only the stress but infections. We spoke about um, environmental toxins, intoxicants. I mean, I'm sure there are other things, but you cover like really the main points. I mean, I guess the big thing is just the time, like how long does it take to,
Okay. Yeah.
get someone and everybody, of course, the answer is everybody's different, but getting back to the symptom management, even though we want to address the root cause, I'll
Mhm.
just say again, it is important to be safe because elevated thyroid hormones, it's not, I mean, it puts stress on the cardiovascular system. It puts stress on the bones. It could definitely affect bone
Yeah.
density in negative ways. So there are a lot of people that read my story, like, I don't want to take the medication. And I could understand because I didn't take it. But if the bugleweed is not working, there's also, I didn't mention L-carnitine and higher doses have been shown to block thyroid hormone entry into the cell. So,
Right.
but if you're taking certain natural agents, for hyperthyroidism, they're not working. It's risk versus benefits. And I mean, the downside is you might not do well with the antithyroid meds, and that's when you might want to look into like the LDN, the low dose
Right. Sure.
naltrexone. And there's,
Right.
yeah, so, but safe symptom management's important. And then again, we're probably looking at, I mean, in my case, it took 9 months before everything looked good, but certainly in some cases it takes longer. It could take over a year for people to get to the point where all the numbers are looking good, and it could be a challenge trying to get those antibodies, normal in some people, finding the triggers. Um, so again, you did a real good job of covering everything, but I guess just the hope that there is hope to reverse Graves, to reverse
Mhm.
Hashimoto's, not necessarily easy, but definitely can be done.
Sure. Yeah. And when I was asking you the question about the other supplements, I was actually hoping you would say L-carnitine. Do you know the mechanism behind how that works by chance? I'm aware of it and I use it, but I don't know what the mechanism is. I'm curious.
I mean, the research just says that it blocks thyroid hormone from getting into the cell. Like if you read the studies, it's blocking the entry of thyroid hormone. And it's funny though. You're familiar with Dr. Isabella Wentz,
Yeah.
focuses on Hashimoto's. And so, I was speaking, I actually was on her podcast talking about hyperthyroidism, and she was talking about, so, I mean, obviously L-carnitine, we know like it's not just for hyperthyroidism. So
Right.
if someone, it's also like helps with fatty acid oxidation and like,
Mhm.
a typical dose, I would guess, with maybe like 500 to 1,000 milligrams. But she was saying that from what her research showed that it's like she was saying it's more of an adaptogenic mechanism. She wasn't really getting into the mechanism, but she was like saying that if someone with Hashimoto's were to take 4,000, let's say,
That's good.
milligrams,
Yeah.
that
Right.
it shouldn't have that same effect of blocking, the entry of thyroid hormone into the cells. So that suggests maybe that isn't the maybe that
Mhm.
isn't the mechanism. So because why would it do it
Sure.
for one category of people, but not
Right.
the other?
Yeah.
Um, but that's if you read and there's multiple studies. There's actually one study, and not that I would recommend it for this purpose, but one study said that it could potentially prevent or serve as treatment for someone who's suffering from a thyroid storm, which is a medical emergency. And
Yeah.
I mean,
Right.
I wouldn't go the
Yeah.
L-carnitine route in
Sure.
that case, but
Yeah. Yeah, absolutely. Yeah, I mean, I was wondering about that because of my understanding of L-carnitine is that typically it's supposed to get the fatty acids inside the mitochondria where they can get broken down and turned into like massive more ATP than you would otherwise get with glucose. So I thought maybe it had something to do with that, but I'm not sure why L-carnitine would specifically block thyroid hormone entry.
yeah.
Why would it do that? I'm just trying to think.
Yeah, and I'm not sure. That's all like, and it might have just been one study that
Right,
mentioned
that said
that,
that. Yeah,
and that high, and I was just thinking, well, maybe it's just the higher doses, and
sure.
maybe they just don't know. Maybe they just
Yeah.
made it up. I don't know.
Yeah, who knows? Well, if it works, I guess is the bottom line. But okay, so where can people go who want to learn more about you?
Thank you. So there's my podcast, Save My Thyroid, which they could visit their favorite podcast platform and just type in Save My Thyroid, or visit SaveMyThyroid.com and click on podcast. I have three books, which you mentioned in the beginning, two on hyperthyroidism, one on Hashimoto's triggers, and they could find those on Amazon. And then my newsletter, Healthy Gut, Healthy Thyroid, which they could check out by visiting SaveMyThyroid.com/newsletter.
Very cool. Well, I will link to that in the show notes. And thank you so much, Dr. Osansky. This has been great.
Thanks, Dr. DeVille. Appreciate you having me again.
Absolutely.